Living with a mental health illness can be overwhelming, isolating, and at times unbearable. Have you or a loved one ever experienced a mental health crisis and felt unsure of what to do or who to seek help from? Are you a caregiver to an individual with an intellectual or developmental disability or behavioral health condition and do not know how to obtain caring and compassionate care for them during a crisis and have to solely rely on law enforcement? Well, there are options for support and care beyond law enforcement and beyond emergency rooms. What is mental health and how can we improve it? The Substance Abuse and Mental Health Services Administration defines mental health as our emotional, psychological, and social well-being. Mental health is important at every stage of life as it affects how we think, how we act, and how we feel, and helps determine how we handle stress, how we relate to others, and make choices. Having a mental health condition can make it a struggle to work, to keep up with school, stick to a regular schedule, have healthy relationships, socialize, and more. However, with early and consistent treatment, often a combination of medication, psychotherapy, and social support groups, it is possible to manage these conditions, overcome challenges, and lead a meaningful, productive life. Sometimes a mental health crisis can happen suddenly, and having the right help can make all the difference. We are graduate students from the School of Social Work at California State University, San Bernardino, and we are raising awareness on Legislative Bill 308 and its relevance to social justice and dignity of those individuals with intellectual or developmental disabilities and behavioral health conditions. So, what is the California Assembly Bill 308 and what does it aim to change? Assembly Bill 308 was introduced by Assemblymember James Ramos on January 23, 2025, and it aims to standardize procedures and trainings in California's mobile crisis response system to ensure that they are equipped with specialized training and procedures. It specifically strives to have individuals previously excluded from services to seek support from trained professionals rather than having to solely rely on emergency departments or law enforcement agents to help when in crisis. This bill seeks to authorize behavioral health directors to collaborate directly with law enforcement agents to develop training procedures for de-escalation, ensuring the safety and well-being of individuals with intellectual or developmental disabilities and behavioral health conditions, as well as offering support to their caregivers. It also promotes equitable access to appropriate care for these individuals and seeks to help reduce their criminalization. In moments of a mental health crisis, timely and compassionate intervention can make all the difference, and that's where mobile crisis teams come in. So what are mobile crisis teams exactly? Mobile crisis services are provided by a multidisciplinary team of trained behavioral health professionals. They provide rapid response, individual assessments, and community-based stabilization to individuals who are experiencing a behavioral health crisis. They are designed to provide relief through de-escalation techniques and to reduce the immediate risk of danger, avoid unnecessary emergency department care visits, psychiatric inpatient hospitalizations, and law enforcement involvement. These mobile crisis teams aim to offer coordinated crisis care 24 hours a day, 7 days a week, 365 days per year. Mobile crisis teams offer relief to individuals experiencing a mental health or substance use crisis wherever they are, whether this is at home, work, school, or on the street. Whether it's for you, a loved one, or someone you're concerned about, they bring compassion, care, and clinical support right to your door. No sirens, no uniforms, just support. What exactly do we want to change? Assembly Bill 308 seeks to authorize county behavioral health directors to develop procedures for mobile crisis teams that include the handling of an emergency situation or a crisis incident involving an individual with intellectual or developmental disabilities, or an individual with a behavioral health condition. Currently, these individuals are forced to seek help at emergency departments or by calling 911, which a lot of the time results in unnecessary hospitalizations or traumatizing encounters with law enforcement, all as a result of the lack of knowledge or understanding of developmental and behavioral conditions. Individuals with a disability in crisis deserve care that understands their needs without judgment, fear, or force. Too often, individuals with disabilities are met with systems that just don't understand them. Intellectual disability is characterized by significantly below average intellectual functioning and deficits in adaptive behavior. It affects how a person learns, reasons, and solves problems, as well as their ability to perform everyday social and life skills. Examples of such include difficulties with communication, learning, and social interaction. That is why individuals with intellectual disabilities need mobile crisis teams. For example, when someone with autism is in crisis, the world can feel too loud, too fast, or too much. In those moments, these individuals need support that understands them, not punishment, pressure, or fear. We are advocating for procedures that respect their needs, their space, and their voice, even when it's not spoken. Currently, autistic individuals get help from law enforcement, but their behaviors are misinterpreted as non-compliance, aggression, or defiance, resulting in traumatic or dangerous encounters. Oftentimes, autistic individuals are also taken to the ER, but encounter challenges such as overstimulation as a result of the bright lighting and noise, which worsens their crisis and a lot of the time results in sedation and discharge without long-term support or understanding of their underlying needs. Another population that Assembly Bill 308 seeks to help are those individuals with a mental health illness, whether it's depression, anxiety, PTSD, bipolar disorder, schizophrenia, or an eating disorder. Individuals with these conditions need to be met by professionals that understand their pain without judgment or fear. Typically, individuals with mental health illnesses go to the ER during a crisis. However, hospitals are not always staffed with mental health specialists. Waits can be long, and care is usually short-term stabilization and not long-term. Family members not familiar with mobile crisis teams call 911, and officers often lack adequate mental health training, which often leads to escalation, trauma, arrest, or even injury, especially for individuals with autism. Lastly, Assembly Bill 308 seeks to also include procedures to help individuals with behavioral health conditions. When behavior becomes a crisis, whether it's ADHD, a mood disorder, or oppositional behavior, it's easy to focus on the outburst and miss the person behind it. But we must be aware that every behavior is a form of communication, and every crisis deserves care, not control. Too often, individuals with behavioral health conditions are met with misunderstanding and with force. Here are some statistics that reflect the prevalence of mental health trends in the U.S. and can help explain why we need mobile crisis teams and standardized procedures for individuals with intellectual or developmental disabilities and behavioral health conditions. For example, 1 out of 5 adults experience a mental health illness. 18% live with anxiety disorders, and 7% live with major depression. 1 out of 5 youth ages 13 to 18 live with a mental health condition. Help is just a call or a text away. You're not alone, and you don't have to navigate this by yourself. Know your options. Call 988, 24 hours a day, 7 days a week. Confidential and compassionate care. As social workers, we advocate for the well-being of the oppressed, and in this case, we seek that this legislative bill passes and becomes law to ensure that individuals with autism and other intellectual or developmental disabilities and behavioral health conditions, as well as their caregivers, become empowered and receive supportive services that address their needs, keeping their stability at the core of treatment, and are no longer subjected to receiving services from law enforcement agents or practitioners that lack proper understanding of their diagnosis.